agreed that UBEC will anchor an alliance with all the suburbs in all the states that we fund. And they all would then buy into a programming node. Right now, what has happened is that about 14 or 15 states have already commenced learning via different channels that are available in their states, mostly radio and local TV. What they are running is an approved NERDC curriculum. Everything that we said we will learn, what teachers need to do. That is ongoing at the moment. Not all the states have started the program, but many states, Anambra, Lagos, a few states, about 14 of them attached here. And the programming times for different ones are. We are also working with the Ministry of Information through NTA and Federal Radio Corporation to then escalate what they normally have as their education content provision so that they can then provide for everybody. They're still working on that. That's an ongoing program. We believe that those who are in private primary, secondary schools already are doing some sort of work with that. We are also available to them to key into things that we have, the resource that is available. All our platforms are available to them. From the national here, every resource we have is available to everybody. Our biggest challenge is to reach children who do not have devices and who are the fringes of our communities. And because they do not have that, that is why you see us pressing on with the Federal Radio Corporation and NTA as the last end to that. That we already have programs running along those lines with adult education. We just want to distill some of that and make it available to primary and secondary. As you are aware, education is a concurrent matter on our constitution, and therefore we can't unilaterally impose a certain level of education participation on states. There must be some sort of buy-in. So we've made all the platforms available. We are meeting with suburbs regularly. We are providing financing. We are providing all the kind of, through the suburbs that we already have, so that they can then do what they think is best at their states. All of that is available. We are also looking at what is required at the level of tertiary education. Most private universities already have some sort of online platforms with which they learn. We are also making resources available and we're assisting them. I'm really going to be great. I'm going to express our thanks to all the participants because everybody has offered us support from content providers to online networking agents to platform providers, MTN, Globe, Nine Mobile, Airtel. Everybody is throwing whatever they have at us. We are willing to absorb all of that and make it available to anybody, any kind of limitation that you're facing from your end. It is our work to address that. We are here to serve. Everything that is available to us is available to you. If you have any new things you would like to explore that is unique to what you're doing and how it can better serve, we are available to do that. All the ICT Directorate is available. If you go to ministryofelucation.gov, you will access all the materials that are available to us and what you will need in respect of each of them. I would like to also say that we're also, willing to work with any platform that can deliver the content we already have. At our level now at the Ministry of Education, we want to unify and help everybody come to par. We are a little bit worried that with the idea that people may not be available to go to school, how do we then reach each person? Because devices alone don't teach, and devices alone don't get you to learn. So we need cooperation of parents. I understand parents are already inundated with being asked to do this or do that. But while we are broadcasting, we cannot also monitor how your child whether he's attentive or not. Kindly make them available to learn at the hours because they are scheduled times. And if you go to our website, you can see in every state what the timing is for them in Ogun State, in Oyo State, in Kano, whatever, and what broadcast channel is available for that. I also have heard there's been some concern with the closure of the National Open Universities portal. Yes, you know there's been a lockdown, so I'm sure as soon as they can, they will get on to allowing more people pay on it. We understand the constraint, and as soon as we can get some people on it, they can open it up further. At the tertiary, our tertiary universities and polytechnics, and they will also have to wait until when the federal government has agreed on when people can move around for them to actually return to their schools. The same reason we ask them to disband or go back to their homes is the same reason why they need to keep away until we are sure that there's some sort of traction to what we are doing. That is, for now, where we stand. We think students who are at home should log on to all the education materials that we have made available. If there are none for your field of study, because there are some practicals we can't do, engineering, some of them are not available at the level, you will have to liaise with your school to then say, this is what our course content for the period under the syllable review or our curriculum or the course content that is available for now is not adequate for what I'm doing, and then they can review how you can participate. You've also heard that we are participating in all the research work that is ongoing, coordinated at TED Fund by the ES there and the Permanent Secretary. Thank you very much.
Thank you very much, Honorable Minister of State Education. We shall now take the questions. The ministers will take their notes after the basket of questions is filled. We will take the answers.
Good afternoon, PTF team. My name is Juliana Taiwo Baloyen. I write for the Sun newspapers. First question goes to Minister of Humanitarian Affairs. Ma'am, Nigerians have been calling for the expansion of the social register beyond the 3.6 million. They argue the period we are in the period we are in is not the time to be rigid with that number. Are you willing to look at that? And there has been a video of a mother and child claiming they got 20,000 naira from the same house. 20,000 naira each from the same household. I don't know if you are aware. If this is the case, how are you checking to ensure, everybody that needs palliative at this time gets it? Since the Minister of Aviation is not here. Oh, okay. Sorry. I didn't see when you came in, sorry. Okay, sir, the question is for you. The Sokoto State Governor expressed worry in a broadcast that two persons, a father and a son, recently tested positive to COVID-19, and they were reported to have recently returned from UAE. The question is, are privileged citizens still flouting the lockdown rules? The Minister of Health, this is for you, sir. Some survivors have been sharing their experiences with the treatment and all that, and they are calling for a total lockdown of this. If we are to flatten the curve of this disease, one of it is that we must do mass testing, for us to truly know the figure we have beyond what they believe the figure we have is probably deceiving people to want to carry on as usual. So they have the opinion for mass testing. And secondly, the strategy should be changed to get the buy-in of the people so that they will cooperate and cooperate during this lockdown. Thank you.
Good evening, the chairman and members of the Presidential Task Force. Good evening, colleagues and Nigerians at home. My first question goes to the Minister of State for Health. We were told on this platform, my name is Mitaire Ikben of the NTA. We were told on this platform that there are about 30,000 test kits at the moment to test for COVID-19. With the preponderance of cases at the moment, has this depleted, and have you increased the stock? We want to know. Then also, the Minister of Health once told us that the Department of Alternative Medicine in the Ministry of Health is looking into claims of traditional treatment for COVID-19. So far, are there any findings? We want to know precisely what is happening in Kano, especially with respect to multiple deaths and reports of mass burial. The national coordinator said that the PTF is following up on cases in Kano, in Oyo, Oshun, and Edo. But Kano is quite worrisome. So Nigerians want to know precisely what is happening in Kano. And again, if here in the Federal Capital Territory, there are designated days for residents to shop in their neighborhood markets. And the days designated so far are Mondays, Wednesdays, and Saturdays, between the hours of 10 to 2 p.m. It has been observed that on these 3 days, because they are actually designated days, there's actually crowded markets, crowded areas. Don't know if the Presidential Task Force has observed this and if there is need for a review of strategy. Thank you.
Good afternoon, Mr. Chairman, members of the task force, my colleagues. My name is Mohammed Saliu Nazif, I work for Voice of Nigeria. For quite some time, we have been focusing and talking and making effort about COVID-19. This time around, I would like to a little bit digress. The African Regional Certification Commission, ARCC, for poliomyelitis eradication team visited Nigeria on the 9th December 2019 to conduct critical analysis and verify the accuracy of the certification of Nigerian government as regards to issue of poliomyelitis. What I want to know is that, has the ARCC visited Nigeria as planned? Secondly, what was the outcome? What was the outcomes of this visit? Sir, can we have some update on the fight against Lassa fever in Nigeria? Because from all indications, COVID-19 has dominated the airwaves, and nobody seems to say anything about Lassa fever and poliomyelitis. So if government can give us a little bit update so that at the same time as we are fighting COVID-19, we can as well do something in that regards. The third question has to do with the stay-at-home order, if a coordinator would like to respond to that, issued by the government, has affected many businesses and labor activities. But I came to realize that within this period, some of our youth are engaging in taking cannabis openly, especially from the area where I stay. So I don't know cannabis. I don't know what NDLEA is doing at a point like this. Are we not supposed to have them patrolling, just like the police are doing what they are doing now? I think we need to have the NDLEA so that they can go into satellite towns and see what is happening. And again, the issue of exemptions on foodstuffs and agricultural products, I think some people are taking advantage of that in supplying some of these stuffs because nobody is checking them. They carry foodstuffs, nobody knows what is under it. And through that, they supply those cannabis and Indian hemps and what have you. And you see a lot of them smoking it openly. So I think that one is something that we need to pay attention. All right, thank you.
Good afternoon. My name is Friday. I'm a reporter with Channels TV. I'd like to ask one question that, if it pleases the Minister of Health to comment on it. I'm taking us back to Kano. You noted in your remarks that the spate of increase in number of cases in some states, including Kano, has given the PTF some concern. So my question is, what particular special intervention are we planning for Kano and perhaps other states that have had a surge in number of cases in the last few days? My second question, it has to do with the distribution of palliatives. So the Minister of Humanitarian Affairs would like to respond to it. A while ago, that is about 2 weeks ago, we were told that 70,000 metric tons of grain were approved for distribution. I'd like to know how many of these have you received, how many have you distributed, and how many states have benefited from it. Because there is a story that is in circulation that our food reserve, the food bank, are empty, and that we don't even have up to 70,000 metric tons of grain. So you might like to respond to that. The third question is actually an SOS that was sent to one of my superiors, and I would like the Minister of Foreign Affairs to respond to it. Nigerians in Tanzania, Tanzania prisons, some of them have spent up to 7 years in prison. They've not raised this kind of alarm before, but now they are scared that they might get infested because more people are being brought from the streets to meet them in the prison. So there is this anxiety among them that if something is not done, they could be infested in the prison cell that they are. So I'd like to know if you are aware of that. If you are not, now that you know, what plans do you have for them? Thank you.
Good afternoon, Mr. Chairman, members of PTF, my colleagues and Nigerians at home. My name is Samara Chiwangoma of Voice of Nigeria. And my question goes to the chairperson and probably the Minister of State Education. Some students of Federal University and Technology, Owerri, of Department of EE, that's Electrical and Electronic Engineering, invented a device to curb the spread of COVID-19. And I'm asking what efforts have been made by this committee or the federal government to get to these students and know the efficacy of their invention. It's actually viral on the Facebook right now. And then secondly, I appreciate our Minister for State for the clearance and the report he gave so far concerning the educational sector and what the government is doing to carry on the children at home due to the lockdown. Now that these children are at home, and we know that the major problem we have in the country is electricity supply. Most of our satellite station communities and even the FCT, we don't have regular supply of electricity. What efforts are you making to bring NEPA officials into this, to know the time for each location so that these students can achieve from whatever plans the federal government is doing for them? And I will ask again in my local language. Nde wo na iwoke nke Minister na Humaka States na agụmakwụkwọ. Anyị ekelele gị na ịnọnyere anyị n'ụbọchị nke taa n'ihi na anyị hụrụ na nke a bụ ụbọchị mbụ na-abịa na ọgbakọ ezumezu a. N'ikwu eziokwu ikwuchala mbọ gọọmenti etiti na-agba iji hụ na ụmụaka ndị nọ n'ụlọ ndị nke na-ele WAEC na-ebugharịala ụbọchị ha ga-eji lee nke a. Anyị hụrụ ọtụtụ n'ime ha lere ule nke eji abanye na mahadum nke a na-akpọ JAMB. Anyị wee na-ajụ ọtụtụ n'ime ha nwetara ka o kwesịrị gbaa tupu ebido ụbọchị isi a. Ndị nke na-enwetabeghị ka o kwesịrị gbaa ihe a na-eme maka ha. Ebe anyị lekwara n'anya na otu ihe chere anyị aka mgba n'iru n'obodo a bụ inye ọkụ latrik. Ọtụtụ ime obodo anyị na ndị dịgasị iche iche enweghị ọkụ latrik. Ndị a na-enye anya ha enye ya kwamgbe. Kedu ihe unu na-eme iji jikọta aka ọnụ unu na ndị igwe ọkụ latrik n'ala Nigeria iji hụ na oge amawapụtara maka mpaghara ebe ọbụla iji kụziere ụmụaka ihe n'igwe ọwa onyonyo maọbụ nke igwe redio iji hụ na ụmụaka anyị ritere uru ọbụna oge a enwere mkpọchisi na mpaghara steeti Lagos, Ogun na isi obodo bụ Abuja na mpaghara steeti ndị ọzọ. Ndewo. Thank you very much.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. Mine is a reaction from the audience, and the question is, how many contacts of the index case in Uyo do we have? A medical doctor that died last week Thursday. Akwa Ibom, Uyo, Akwa Ibom State. A medical doctor died last week of COVID-19, and the medical personnel that attended to him before his death have been in self-isolation. They have tried to contact the NCDC, but there has been no response up till now. Why is there a delay? Why is there a delay in the response? Then secondly, I got a call from the Association for People with Disabilities, and I spoke with someone that was blind. He said during the weekend, the association gave him some palliatives to distribute to his members in Cuba. He said he was on his way to give them out. He was on a bike, and suddenly his niece was giving him direction. So suddenly a security agent in a vehicle just descended on him, and they started beating him. I actually spoke with him, and I saw blood on his face, and I want to know if the SGF could follow up on that. Thank you.
Good afternoon, sirs. My name is Nancy from AIT. Please, my first question will go to the Minister of Environment. Now, access to potable water and sanitation, we see, is a major challenge in rural areas. And of course, we know that some of the precautionary measures in the fight against COVID-19 is the constant washing of hands, which these people do not have. I don't know if your ministry is doing something in that regard to provide potable water for these people. Now, yesterday, the Minister of Health, this goes to the Minister of Health, he made mention that health workers are only tested when they begin to show symptoms. I'm aware there is a case somewhere in, I think, Iceland, where over 100 medical personnel tested positive to COVID-19, and they have been working on their patient. So my question now is, should we wait for our medical personnel to have symptoms before we test them, those that are working on patients who are COVID-19 positive? And this question I asked yesterday, probably it was an oversight. I think I want to ask again. And I'm directing it to the Minister of Information, Alhaji Lai Mohammed. Sir, Kumo of CNN is recuperating from COVID-19. And Richard West, he's also a broadcast journalist, popularly known, has also tested positive to COVID-19. It goes a long way to tell that not only the health workers are vulnerable, the journalists are also on the front line. So my question now is there anything the federal government, through your ministry, is doing to assist or kind of palliative or insurance for medical, for journalists, both in the private and, of course, public sector? Then I have this one. Retirees under contributory pension scheme have not been paid for over a year. Last time I checked, they were paid in 2018, and most of them are old and retired. They have nothing they are doing at this point. They are at home. The lockdown is biting very hard on them. I don't know if what the task force can do to ensure their monies are paid. Thank you.
The Chairman, National Coordinator, Honorable Ministers, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question really is to the Chairman. And the 2 weeks extension of the lockdown is going to elapse this week. So I want to know what your advice would be to Mr. President, especially looking at the numbers that we have in recording in terms of confirmed cases. And if you're going to advise the President to extend the lockdown, I'm going to add the Minister of Humanitarian Affairs to this question now. Have we given enough palliatives to tell people to stay at home beyond the 1 month they're currently staying? That's one. And the Minister of Aviation, well, yesterday we got an update that, of course, the airspace, the lockdown has been extended as well. But today in the nation's capital, Abuja, we noticed a lot of air movement. So if would like to get an explanation as to what's going on, so that way people understand really. And finally, to the Minister of State for Education, well, thank you for all that you have said in terms of what your ministry is doing to ensure that our children stay educated. But I visited your website as you spoke about it, and the website is not that easy to navigate. And I'm concerned about the rural poor who don't even have the access to the internet in the first place. What are you going to do to ensure that they are not left out? As it stands right now, we already have the highest number of out-of-school children prior to the lockdown. And with this, we can't afford to see more children not get educated. Thank you.
Thank you very much. That brings us to the end of the questions. We shall now take the answers. They have been directed at the following: the Honorable Minister of State for Health, the National Coordinator, the Honorable Minister of Humanitarian Affairs, Honorable Minister of Aviation, Honorable Minister of Foreign Affairs, Honorable Minister of Information and Culture, Honorable Minister of State for Education, and the SGF. We shall Minister of Environment. Okay. We shall begin with the Honorable Minister of State for Health.
Right. Once again, Mr. Chairman, my colleagues on the PTF team, distinguished ladies and gentlemen, thank you for your interventions, those who have been able to make interventions. I think the first question had to do with the advocacy, I will call it, of the survivors of COVID-19. That is, those who had been treated and have survived it, coming to tell their own stories, and now advocating the need for mass testing. And secondly, the need to change strategy. First is to thank those survivors who have been bold enough to come out to share their experiences and let the doubting Thomases know that truly COVID-19 exists. It's not one of the situations where you will want to say experience is the best teacher. But again, experience has shown that people want to believe the evidence before their eyes. So we thank God for these ones. Yes, we agree that there is need for increased testing. The limitation we have at this point in time is the fact that more labs are being opened because the PCR-based testing method that we use may not give us the mass testing that we really require. We are limited because we are not using the rapid test kit, and it's because it's not been certified by the WHO, aside the margin of error. But then we take it that the challenge, and we believe that the NCDC is working hard on it. You will recall that we started from just about 5 laboratories, PCR-based, and now we have 13. And I recall that sometime last week or thereabout, the DG of our NCDC was here to tell us that the challenge even now has to do with people coming forward to be tested and the associated logistics. So I'm saying that in spite of the 13 laboratories that are presently functional, we can still do more if people show up to be tested. And we will improve in that regard. Of course, the issue of having to change strategy is inevitable because we have moved into community transmission. And therefore, we need to ramp up our response activities. We know the whole thing started from Lagos, which used to be the epicenter. But as we are moving on now, we can see that there is a rapid spread. So it means we also have to move to test more, to isolate more, and of course, to treat more where treatment is really required. So it has never been a situation of one size fits all. We know that along the line, as the situation demands, we will need to be innovative in our approach, or creative, and be adaptive, and also be flexible. And that's one of the things, or that's one of the reasons why we advise our people to use a face mask, and that it doesn't have to be the regular type, as some of us are using right now. It doesn't have to be medical mask or surgical mask. It could just be any cotton material that is suitable, that we can wash. We believe that this will go a long way to help. I think the question from Itari, if I remember very well, has to do with what has been the outcome, or how far with the traditional, complementary, and alternative medicine in terms of remedy for COVID-19. Yes, I remember that some time ago I did say that there had been requests made by some practitioners of herbal medicine laying claims to having remedies that could help or treat COVID-19. And I remember I did say then that we encourage these people to come forward with their remedy. But these remedies, they have to go through the proper protocol of assessing the efficacy. It's not enough for people to make claims, but we need to subject such claims to the protocol for assessment. And in this regard, the traditional, complementary, and alternative medicine department of the ministry, as well as the National Institute of Pharmaceutical Research and Development, they are working together to look at these claims being made. But I can also tell you that a lot of times, some of those who make this claim, they fail to really come up with remedies for proper protocol of assessment. Then there was a question regarding the certification on polio. Yes, the team, the African team that came around to assess our readiness, they came and we were given a clean bill of health. That is, that we were doing well as we approach the D-Day, which is supposed to be June, a couple of months from now. So they went around all the regions, the geopolitical zones, for their assessment. They came in first to let us know what they want to do. And after moving around the 6 geopolitical zones, they also came back to give us a feedback. And the bottom line is that they were satisfied with what they saw in the various places they visited. So that gave us hope, and we're very excited for the report they gave. And so we are still working towards that, and we believe in the grace of God that come June, Nigeria will be certified polio free. Yes, we are not neglecting the other diseases like Lassa fever you mentioned. We are getting reports from the various states, particularly those states that appear to be the epicenter, and we have not really had the rise in the figures. So, which means that we are not really having new cases. And what we know about Lassa fever is that it has a period where there is a spike. That's usually towards the end of the dry season. So it's like that period is kind of over because we're not really having outbreak as we had earlier on in the year. I think Friday, your question was directed to that has to do with what we're doing regarding the situation in Kano. I'm sure the national coordinator will talk more about this, but I can just say that ordinarily what we will do, part of what we will do is to increase the support for Kano. You recall that Kano and Lagos, they have the highest population, and naturally we will be worried what Kano or what Lagos has is also what Kano has in terms of population, in terms of the density of this population, and in terms of activities, commercial and otherwise. So we need to do more of contact tracing where we can. We will need to do more testing, more isolation, and of course treatment where we need to as well. I think the issue that was raised regarding Uyo, I hope I got it right, that is being looked into, and the NCDC will give us an update on it. I think the last I have here is testing for health workers. Well, for me, the testing for health workers will be both. That is, the first being routine testing, and of course the second one is as indicated. That is, if a health worker comes with symptoms that are suggestive, that health worker will naturally need to be tested. And of course, under the basic guideline, if a health worker in any way has come in contact with COVID-19 positive case, that health worker naturally knows that he or she will have to go into self-isolation for the 14-day period. But as much as possible, what the Ministry of Health and other relevant agencies are doing is to ensure that our health workers, they are properly protected. And I did mention this in my earlier report, because we need to protect our health workers so that they are not unduly exposed. This is the basic thing, in fact, it's the minimum that we owe our health workers. We want to be sure that they are well protected, and that if and when the need arises for them to be tested, they will be tested accordingly. But I'm saying that in addition, there may be need for any health worker who reasonably feels that he or she has been exposed to submit himself for routine testing. Thank you.
The National Coordinator.
Thank you. Before I answer some of the questions I have, I would like to appeal to the floor to please stick to the issue of COVID. Let us not move on to other health topics. While they are important, there's the risk that we will dilute our effort, and I think we need to remain focused. So please, let's stick to the COVID issue for now. Thank you. So the issue of markets, yes, we'll continue to monitor. As you know, here in Abuja, the markets are controlled by the FCT, and continue to work with them closely. It's not an easy decision. If we reduce the frequency of the markets, more and more people will be attending. If we increase the frequency, on the other hand, we may also have the same issue. So it's a balance, but we are looking into it, and we'll continue to monitor. Stay-at-home order, and the issue of cannabis. I would like to assure you that cannabis use is not part of the exemption criteria for violating the stay-at-home order. So it's really a law enforcement issue, and NDLEA, as other law enforcement agencies, will continue to monitor this. Kano. So we have been working quite closely with the state authorities in Kano. Over the weekend, we engaged directly with the state governor, and virtually over the last 2 days, I have been talking to people in Kano to find out what is going on. It's not very clear whether the reports that we're getting are actually factual or not, but they have set up a team that will be looking at investigating this further. In terms of what we are doing from the Abuja side, as you're probably aware, the DG NCDC has made an on-the-spot assessment yesterday. They just left Kano today. We've also sent rapid response teams to Kano. We continue to engage with the government in terms of testing. The test center in Kano started last week. We are also looking at opening more centers for sampling, for taking samples, so that we can increase the number of tests and also improve the efficiency of contact tracing. We continue to ask persons to respect the stay-at-home order in Kano, which was placed by the state government. The best way of avoiding catching COVID is really to keep your distance from others. We have also today discussed the Kano issue in detail at our PTF meeting, and will be reaching out to the state authorities to support enhanced surveillance. We definitely recognize the need for more testing, and also the need to reach out to communities to convince them to continue to support and cooperate with us while we work on reducing the impact of the pandemic. Thank you.
Honorable Minister of Humanitarian Affairs.
Thank you, Mr. Chairman, my colleagues, and distinguished ladies and gentlemen. I think let me start with the question on the CCT, the conditional cash transfer. That how are we doing the expansion of the registration? Well, we are using other models because, as I mentioned on this platform, we want to really focus on digitalizing this process. So we're using the BVN, so the bank accounts, as well as mobile phone networks, to identify these poor and vulnerable people in the society. That's going to be faster, and there's going to be transparency and accountability. On the issue of a lady showing that two members of a household being given the cash intervention, I think this is near impossible, because the process involved is a very, very tedious process where all critical stakeholders in the community are involved, the community leaders, and the faith-based organizations, the leaders, the youth, the women leaders in that particular community. They are the ones that come up with a list of poor and vulnerable households in that community. And if we go through the list, individually they submit this list. And if we go through the list, a particular household belongs to the three of the list submitted. I mean, they fall within these three, but maybe say the youth organization, they don't have that household in their list. You are not qualified to be in the register. So it is almost impossible for the same members of household to get this intervention. But we'll go back and investigate very well on this, but it's almost impossible. On the issue of the how are we giving the palliatives, I mean, the duration it covers. For the federal government, palliatives is for a minimum of 2 months. That's the package we have for the food relief. And even for the cash transfer, you may recall Mr. President directed that we give 2 months advance payment to these households. So I think we'll be able to adequately, cater for these vulnerable groups, given the 2 months package that we're giving them. There's another issue on the grains. Yes, 70,000 grains were approved by Mr. President that should be given to the ministry, to the PTF through the ministry, to distribute to the 3 affected lockdown states by the federal government, and then to the other frontline states. So far, we have deployed 279 trucks of these grains to these 3 affected states or locations locked down by the federal government: Lagos, Ogun, and the FCT. We're making plans for the next deployment to the other frontline states. We have not taken all the 70,000, so we still have some grains in the silos. Metric tons is quite a huge number. 10,000 or 2,000 metric tons will require nothing less than 30 trucks to deploy. So it's quite a huge number. And there's nowhere we can put these grains. We have to leave them in the silos and be deploying as the need arises. Thank you very much.
Honorable Minister of Aviation.
Good afternoon, gentlemen of the media. And also permit me that I address you, gentlemen of the media, because I was a long time ago corrected while I was in the House of Reps that there are no ladies and gentlemen of the media. They are all gentlemen of the media. I've been often attacked, on Twitter that I don't recognize women. No, I do. I have 2 wives and so many girls as daughters. Right. Regarding the question that you noted some flying activity around Abuja, that is the second question. I think this is occasioned by the information dished out by Nigerian Air Force that they will be carrying out some activity about this week to celebrate or to mark their week, I think tomorrow. So I think maybe a rehearsal of that. But suffice to say that every single flight that you would see, every single one that we would approve would be an essential flight. Every single one. And that essential flight, 98% of them will be connected to COVID-19. A few of them, maybe 1% might be either repatriation request from diplomatic community, which must go through foreign affairs, or it might be repatriation due to illness of another kind, medical evacuation. And those evacuations would also need stamp of a teaching hospital, which we said before. However, I just want to share with you a discussion I had on Twitter with someone when I said that as a result of the extension of the lockdown, we would not be able to open our airports and airspace for normal operations. And someone said, kindly also stop all the VIP shuttle going out or going on. It makes no sense to lock citizens up and allow governors stream in and out of Abuja. In the first instance, they carried this virus into Nigeria. Now running around isn't okay. So I said to the gentleman that I agree with you. However, trust me, whatever is approved or whoever is approved to fly privately, governor or no governor, is an essential trip and a value addition. And 98% is related to COVID-19. There is no exception to governors. I had denied several of such flights, including 2 governors from South-South, 2 from Southeast, and by the way, 3 of them are members of the APC. But I think one is from North Central. Just to say that once you see a flight approved, it's diligently done. It must be essential, it must be COVID-19 related, or it's some other flights like cargo, essential cargo, that will bring in medicines or equipment, or something related to COVID-19, or something related to our own well-being, like food, and so on and so forth. So please trust us and bear with us while this will last. It will be short, by God's grace. Thank you.
Honorable Minister of Foreign Affairs.
Good evening, everybody. The question was in regards to Nigerians in a prison in Tanzania, and if I was aware of that and the possibility of their being infected by COVID-19, and that now that I'm aware, what am I going to do about it? Well, I'm not aware, and it would have been interesting to have found out how the questioner became aware, because of course in this day and age all kinds of facts and figures and fiction floating around. But what I will do is get in touch with our High Commissioner in Tanzania, and then we'll take it from there if that is the case. Thank you.
Honorable Minister of Information and Culture.
Thank you, Mr. Chairman and colleagues. I think the question that was asked, citing 2 international journalists who contracted COVID-19 is a very, very pertinent question. As I always say, as of today, there's no known vaccine or medicine for COVID-19. The only strategy that we are employing is actually the non-pharmaceutical intervention, which is advocacy, enlightenment, and sensitization. And this cannot be carried out without the support of the media. Therefore, it won't be wrong to classify journalists as frontline soldiers in the fight against COVID-19. But for the media, how are we going to get across to the public our advocacy campaigns, whether in the area of social distancing or not gathering or physical hygiene? So I agree with you absolutely that you are a frontline warrior in this particular fight against COVID-19. And of course, we've always used the analogy that this is a war, but this time around, it's a war with an invisible enemy. And I think just as our health workers, our airport workers, our immigration workers, and etc., are frontline soldiers in this battle, in this war, you also are. And I think it won't be out of place to take up this matter at the level of the task force and also engage your employers as to what kind of arrangement can be made for those of you especially who have been with us every day. We pray, yes, that none of us will contract the virus, but really, you are probably more at risk, also as much as risk as the health workers. And this also gives the opportunity to please immensely thank the media for the support we've received from them. It is true that when I came here a few minutes ago, I spoke largely about NTA, FRCA, NAN, and VON. But the story will not be complete without giving, due respect and, giving appreciation to the private media. Also, TVC, AIT channels have all been calling our press conferences live without any charge. We thank you very much for that very patriotic, duty you've been doing. Newspapers. Arise. Thank you. I must say that it's not just private TV stations. Also, private radio stations have been giving us a lot of coverage. So we thank them, and even newspapers. And I want to assure you, by the grace of God, when we overcome COVID-19, you'll be one of the heroes of this war. Thank you very much.
Honorable Minister of Environment.
The question was on access to potable water, clean water, especially for sanitation in this time period. Generally, water and sanitation, of course, go hand in hand. But right from the beginning of all this exercise, the lockdown and everything, Mr. President made it clear that essential services must be kept running, going, water, which is part and parcel of that. The synergy between Ministry of Water Resources and Federal Ministry of Environment to make our water potable, whether it's pipe-borne water or people that live in the rural area. The Ministry of Environment, our sole responsibility to keep the environment clean, to prevent pollution both on the land, water, and air, particularly water pollution. We have a Department of Pollution Control, and we do everything humanly possible to safeguard the quality. Even if you are treating your water and sending it through the pipes, you still need to have good quality raw water in the rivers and streams to be able to clean it easier and send it. And where we don't have that, we make sure we maintain the quality and integrity of our lakes, rivers, and streams because we know there are people who have no access to pipe-borne water. The sanitation part, which is what the Federal Minister of Environment give the technical advice, while the water resources supply the water, of course, you wash your hand at least 20 seconds under running water for the prevention of corona. Where you don't have running water, or then you can have somebody pour the water for you to wash. Where you don't have someone to help you do that, have the container, use your wrist, and wash and wash and wash. You can always improvise. But the thing is, make sure you maintain that sanitation. Thank you.
Honorable Minister of State Education.
Thank you. I think I'll just start with the question from Arise. Yes, because I was on Arise News program this morning, and I tried to explain how you can get online. I'm not sure why you're not, I'm sure it's not as fast as you will expect, but I'm sure some of the content will help with the work you do. If there are gaps that you notice or in the areas that you may want to get some feedback, let us know at the ministry. We're still working on them. So anything you need in that regard, we'll work with you to do that. That also relates to your question about the number of out-of-school children we have. Since they can't, if this platform is not working so well, wouldn't that impact on how many children have access to learn? Of course, we know it is. In fact, this is part of our approach to solving the OS syndrome, the out-of-school children, because we feel that we're only just being drawn into something that we are already planning to escalate. In northern Nigeria, where we have a lot of children out of school, we have been working with the governors to formalize some of the institutional ways that they learn that are not necessarily formal. We've worked out programs with the Ministry of Humanitarian Affairs that we were in the process of executing. Some of the contradictions of this present challenge would be that you've heard that Kano State wants to deport some Almajiri children back to Katsina, 400 and so on. Some will go to Susan, so they will disperse them. And this has always been at the root of our argument that whatever policy we are going to do to have to accommodate all of them cannot just be state-specific. It will be holistic. And the coronavirus pandemic and the gaps that education has seen now will be used in solving our problems as we go along. This, your question, also dovetails into the question from the Voice of Nigeria, which in the main wants to know how those who are without light, those who are constrained by some of these things, they don't have devices, would then be people who we will want to bring onto an online learning platform. Yes, we are aware. There are no devices produced in Nigeria. Almost all of them are imported. People are limited by the ability to access them. And we can't provide light in every home, but part of what we're doing with Ministry of Information is to make sure that some of this is available to terrestrial broadcast media, not just online. And if you don't have devices, then you can watch them on TV. We are working, like I told you, with all the state governments, SUBEBs, because the SUBEBs get their funding from the implementation of the UBEC Act of 2004. And by that, it is a resource from the federal government. And with that, we can ask to collaborate, and we've asked them, and they are all online. I've given you how many states that have already published their timetables for the timing when you can put your radio on or your TV on to be able to access that. And when I first made my presentation, I appealed to parents that this is important, that they guide the students. Most of them may not on their own ordinarily. Truancies can be at home or at school. So we still need your guidance and your participation. In the main, that is what was asked in Igbo. So I would now phase into that. maka ajụjụ iji mee ka elu otu ndị mmadụ na-esi mee mụọ ihe ndị akụziri. Ọ ya ihe ndị m kọwaga kemgbe na onye nwere ohere ya mụịgha redio ya ma ya mụịgha telivishọn ya ji isi ike nne ya na nne ya ha niile tinye okwu n'ọnụ a ha ga-anụ ihe ndị steeti ha kwuru sọ nga aga na-amụ akwụkwọ ma ihe ndị eji mgbe ọ ga-eji oge ya ruo klaasị ka ya mgbe ọ ga-eji wụrụ ya agbaghị ya mara mgbe ihe ndị ekwughe ma mịa na papa ya ha kụziere ya jie otu a na-esi mee ya wụrụ na ya onwe ya so na-amụ ihe amụgha na ụlọ akwụkwọ niile ndị na-enwe ha ọkụ ndị na-enwe ha mmiri ya oru mgbe oge o ruru mgbe eji eme ka unu agbagha unu na-eji egere ya maka onye ọwụla amụta anyị. Ọ bụ otu aka ka m jikwa aza na ọ bụ eziokwu isi na ndị JAMB na ha ewepụtara rezọtụ ka izizi ka ugbu a ha ga-ewepụta bụ ma emechaa mgbe ndị mmadụ akọwacha ndị ya fọrọ a ga-enwe ihe ndị fọrọ ndewonu.
Thank you, Honorable Minister of State for Education. We now invite the Secretary to Government of the Federation, SGF, sir.
Let me start with the last one, which I think nobody has addressed. Amaka, I think you asked whether we could divulge the content of our report to the President. What we will be reporting on. I think my paragraph 4 this afternoon is very explicit when I said, while the PTF continues to assess the impact of the lockdown preparatory to the submission of the report to the President, it presupposes that there is no report ready. So we have to wait until the report is ready and we submit it to Mr. President. Okay, I'm looking forward to it. Okay, when we get there, we're still expecting a report from Kano and the other places from the DG and the World Health Organization that will inform what... I don't have a phone here. I think it's your phone. So let me go over it again. No report is ready. We're yet to do a report. We'll wait until the appropriate time, get all the information that will inform the decision of Mr. President, and we will submit a report. And I did allude to it in my speech, in my remarks this afternoon. The other question has to do with somebody living with disability that reported to you. Can you forward the details of that report to the Secretariat of PTF? We will take it up from there once we can establish his or her identity and the officer that committed the infraction. We will take it up from there and ensure that no Nigerian is subjected to indecent treatment for whatever reason. The other one has to do with inventions and innovations that are taking place. I can assure you that after COVID-19, Nigeria will not be the same again because of the level of entrepreneurship, inventions, and innovations that have been demonstrated by Nigerians. But you know, like anywhere in the world, these machines, these products will have to go through some processes of licensing. First, accreditation, investigations, and eventually the other patented or licensed for mass production and use. You don't invent a machine today and just put it to use. We are dealing with a life and death situation. I've seen a lot of products. Some were brought to my office by people from DICON. Excellent work. Others from different universities and different institutions. I think this falls under the province or the jurisdiction of the Honorable Minister for Science and Technology. And he did attend even an exhibition at the Eagle Square about 2 weeks ago, where some agencies that are directly under the ministry had produced walk-through disinfection process and also some ventilators. I believe after COVID-19, Nigeria would have stepped up its inventions and innovations, and by the time these things are licensed, we will not have to go outside this country to buy anything. There are a lot of groups that are producing even the PPEs that we are looking for. Most countries have run out of stock. But you see, even the local ones that are produced here would have to go through a process. There are bodies of government that have been established for that. Even the issue about the local herbal concoctions that are supposed to be used for treatment will have to go through a certification process through NAFDAC and other agencies before it will be deemed fit for human consumption. It will take time, but I believe that COVID-19 has given us an opportunity to begin to kick into manufacturing and production and scientific research so that after COVID-19, our country will be dependent on itself for the production of these items. The last is the issue about drugs, which was asked, and the fact that a lot of the youth that are supposed to be in school or gainfully engaged in other activities are busy having a field day with drug abuse. Well, before COVID-19, we had several battles and wars that Nigeria was fighting. First was the issue of insurgency in the northeast, banditry in the northwest, all forms of criminality, kidnapping, oil bunkering. All over the country we had these major senses of insecurity. But there's one that has reared its head, even before COVID-19. There's substance abuse, drug use and abuse, which for all intents and purposes is even more dangerous than the insurgency. And that informed the decision of Mr. President in 2018 to set up a committee, or a two-phase committee. PASEDA, which did the preliminary work, and MASEDA, the Ministerial Steering Committee, which I have the privilege to chair. The report of the PASEDA has been submitted to government. And MASEDA, which is the Ministerial Steering Committee, has looked at the report and have made recommendation to Mr. President on an interim level. And in the month of February, I think I did a memo to Mr. President asking him to approve for him to personally launch a war against drug abuse in Nigeria. Because I consider that to be one of the most dangerous wars that this country is facing today. Why do I consider it a very dangerous war? One, it is a war that can creep into a community and has the potential of wiping out 2 generations. When you have parents on drugs and children on drugs, these are 2 generations that can be wiped out in a go. So it's a very, very serious war. But the entire world did not prepare for COVID-19. COVID-19 has come and it has overtaken us. It's overwhelmed every country. And for now, the priority is on COVID-19. But I believe that when we get across this, the next battle that we must wage is to deal with substance abuse and drug use in this country. Thank you.
Thank you very much. With the response from the SGF, we have come to the end of today's national briefing. But a few messages are coming out. One is from the education sector. It's directed at parents. Parents, please guide your children ensure that they engage in various online and terrestrial broadcast programs put in place by the education sector while at home. They are not on holidays. The second one related to that is that please, parents, watch and ensure that they do not indulge in drugs and other vices. Above all, please remember, wear your face masks, ensure good personal hygiene, observe social distancing, report any sign of symptoms. Do not stigmatize any infected person. God bless Nigeria. We'll see you tomorrow by the grace of God.
President Buhari calls for urgent measures towards speedy trial of cases and decongestion of custodial centres.